What is the correct first step in preparing for a capillary collection? A. Warm the puncture site. B. Identify the patient using 2 identifiers. C. Sanitize your hands. D. Position the hand below heart level. Answer, B. Patient identification must always occur first using at least 2 identifiers before any preparation. This prevents specimen mislabeling or wrong patient errors. A heel stick should not be performed where? A. Medial plantar surface. B. Lateral plantar surface. C. Center of the heel. D. Outer side of the heel. Answer, C. The center of the heel is near the calcaneus bone, increasing risk of injury. Puncture should be done on the lateral or medial edges to avoid nerve or bone damage. What is the main concern when performing a capillary stick on a newborn? A. Hypokalemia. B. Excessive tissue fluid contamination. C. Insufficient clotting. D. Excessive clotting. Answer, B. Too much squeezing during collection causes tissue fluid to mix with blood, diluting results and affecting accuracy, especially with electrolytes or glucose. Which complication may occur if the tourniquet is left on too long? A. Hemoconcentration. B. Hypovolemia. C. Vasodilation. D. Clotting of the blood. Answer, A. Prolonged tourniquet use causes pooling of blood and fluid shift, leading to concentrated levels of analytes like potassium or protein, known as hemoconcentration. If blood flow stops during venipuncture, the phlebotomist should first A. Apply a second tourniquet. B. Redirect the needle slightly. C. Ask the patient to clench their fist. D. Remove the needle immediately. Answer, B. Blood flow may stop if the needle is against the vein wall. Slight redirection may re-establish flow. Removing it without trying redirection is premature unless there's pain. The best method to confirm the identity of an unconscious hospital patient is A. Ask the patient's family. B. Check the wristband and medical chart. C. Match with room number and nurse's confirmation. D. Call the patient's name loudly. Answer, B. Use of wristband and verifying against the medical chart is essential. Verbal confirmation is not possible, and room number alone is not sufficient. Which department does a green top tube typically go to? A. Blood bank. B. Microbiology. C. Chemistry. D. Coagulation. Answer, C. Green top tubes contain heparin and are primarily used for chemistry panels, such as stat electrolyte and ammonia testing. What should be avoided when labeling a blood specimen? A. Writing directly on the tube. B. Including patient's name and DOB. C. Using pre-printed labels with barcodes. D. Labeling before the blood is drawn. Answer, D. Always label after collection in the patient's presence. Labeling beforehand risks misidentification if the wrong tube is drawn. What is the most appropriate action if a vein collapses during blood draw? A. Reapply the tourniquet tighter. B. Continue pulling with higher vacuum. C. Remove the needle and choose another site. D. Ask the patient to squeeze their fist. Answer, C. If a vein collapses, it is unsafe and ineffective to continue drawing. Remove the needle and choose an alternate site or a smaller gauge needle. A specimen requiring protection from light should be transported in A. A centrifuge. B. An amber-colored tube. C. An ice slurry. D. A glass container. Answer, B. Tests like bilirubin and vitamin B6 degrade with light. Amber tubes or wrapping in foil protects from photodegradation. Which department handles blood cultures? A. Serology. B. Hematology. C. Microbiology. D. Immunology. Answer, C. Blood cultures are used to detect microorganisms in the blood and are processed in the microbiology department. Why is EDTA the preferred anticoagulant for hematology tests? A. It binds potassium. B. It inhibits thrombin. C. It preserves cell morphology. D. It separates plasma from cells. Answer: C. EDTA binds calcium and prevents clotting, while maintaining cellular structure for accurate hematological evaluation. What is the risk of puncturing through the vein? A. Hemoconcentration. B. Petechiae. C. Hematoma. D. Air embolism. Answer: C. Puncturing through the vein causes blood to leak into surrounding tissue, resulting in bruising or a hematoma. How should a phlebotomist respond if a patient refuses to have their blood drawn? A. Restrain the patient. B. Notify the physician or nurse. C. Document it and proceed. D. Call hospital security. Answer: B. Patients have the right to refuse care. Informing the medical team is appropriate so the situation can be handled medically and ethically. A CBC and respiratory count are ordered. Which tubes are needed? A. Green top only. B. Lavender top only. C. Lavender and light blue. D. SST and lavender. Answer: B. Both tests require whole blood and EDTA anticoagulant for cell preservation, which is found in the lavender top tube. What is the maximum depth for a heel stick in a newborn? A. 1 mm. B. 2.0 mm. C. 2.5 mm. D. 3.0 mm. Answer: B. CLSI guidelines recommend no more than 2.0 mm depth to prevent bone injury during neonatal heel puncture. Blood from a capillary stick mixes venous and arterial blood, making it ideal for A. Serum protein electrophoresis. B. Glucose monitoring. C. Coagulation studies. D. Blood culture. Answer: B. Capillary blood is suitable for point-of-care glucose testing due to its representative arterial composition. It is not valid for coagulation or blood cultures. If the blood in the collection tube begins to hemolyze, what should you do? A. Shake the tube vigorously. B. Stop the draw and start over. C. Add anticoagulant manually. D. Continue and note it. Answer: B. Hemolysis compromises test results. Stop the collection, use a larger needle or gentler technique, and recollect to preserve specimen integrity. After drawing a PT and CBC, the tubes are shaken instead of gently inverted. What test result will most likely be affected? A. Glucose. B. WBC count. C. Hemoglobin. D. Potassium. Answer: D. Shaking causes hemolysis, which releases intracellular potassium into plasma, falsely elevating potassium levels. Which of the following tubes must be filled completely to avoid dilutional effects? A. Lavender top. B. Light blue top. C. Red top. D. Gray top. Answer: B. Light blue tubes, sodium citrate, require exact fill to maintain the correct blood-to-additive ratio critical for coagulation testing. What is the correct action if the blood in a light blue tube is below the fill line? A. Send it anyway for testing. B. Pour blood from another tube. C. Discard and redraw the sample. D. Add saline to reach the fill line. Answer: C. Coagulation tests require a precise 9:1 blood-to-additive ratio. Underfilling alters this ratio, invalidating results. A redraw is necessary. Why must serum tubes clot completely before centrifugation? A. To prevent platelet loss. B. To avoid cellular contamination. C. To ensure proper serum separation. D. To activate the clotting cascade. Answer: C. If centrifuged before clotting, fibrin strands remain in the serum, leading to specimen rejection or inaccurate test results. Which additive prevents clotting by inhibiting thrombin? A. EDTA. B. Heparin. C. Sodium fluoride. D. Sodium citrate. Answer: B. Heparin inactivates thrombin, preventing the conversion of fibrinogen to fibrin, thus inhibiting clot formation. What is the purpose of inverting tubes after collection? A. To activate clotting factors. B. To remove air bubbles. C. To prevent clot formation in additive tubes. D. To separate plasma from cells. Answer: C. Gentle inversion ensures the additive mixes properly with the blood, preventing clots and preserving the sample's integrity. During capillary collection, which factor contributes most to hemolysis? A. Using a glass capillary tube. B. Wiping away the first drop. C. Applying excess pressure to the site. D. Allowing the puncture site to air dry. Answer: C. Squeezing or milking the site introduces tissue fluid and damages cells, leading to hemolysis and invalid results. Which blood tube is used for blood bank testing? A. Light blue top. B. Lavender top. C. Pink top. D. Green top. Answer: C. Pink top tubes contain EDTA but are specifically designed and labeled for immunohematology, blood bank, testing. A patient develops a large bruise after venipuncture. What is the most likely cause? A. Use of a tourniquet. B. Leaving the needle in too long. C. Inadequate pressure after draw. D. Collecting blood from an artery. Answer: C. Not applying enough pressure after needle removal allows blood to leak into tissue, causing hematoma formation. Which tube additive inhibits glycolysis? A. Sodium citrate. B. Potassium EDTA. C. Sodium heparin. D. Sodium fluoride. Answer: D. Sodium fluoride prevents glycolysis, preserving glucose levels in blood samples for up to 24 hours. If a patient has N4 in both arms, what is the best option for collection? A. Use either arm. B. Collect below the force site. C. Draw from a foot vein with physician approval. D. Stop the 4 and draw above the site. Answer: C. Drawing from below or near N4 site risks contamination. A foot vein may be used only with a physician's written order due to circulation risks. Capillary blood collection is contraindicated in patients with A. Low platelet count. B. Severe dehydration. C. Neonatal jaundice. D. Cold extremities. Answer: B. Dehydration reduces capillary blood flow and may yield inaccurate or difficult collection. Venous access is preferred. Which color tube should be collected last in a capillary draw? A. EDTA, lavender. B. Heparin, green. C. Sodium fluoride, gray. D. Serum, red. Answer: C. In capillary draws, the order is lavender, then other additives, with gray collected last to prevent interference from fluoride with other test results. Which of the following errors is most likely to compromise test results? A. Inverting the tube 5 times instead of 8. B. Using a tourniquet for 30 seconds. C. Failing to identify the patient. D. Drawing a light blue tube before a red top. Answer: C. Patient misidentification is a critical error and can lead to serious medical consequences, including treatment based on the wrong results. What is the function of the gel in SST tubes? A. Anticoagulant. B. Coagulant enhancer. C. Preserves glucose. D. Separates serum from cells. Answer: D. The gel forms a barrier between serum and blood cells during centrifugation to prevent analyte contamination. Why is the first drop of capillary blood wiped away? A. It's contaminated with sweat. B. It contains tissue fluid. C. It causes clotting. D. It dilutes the specimen. Answer, B. The first drop includes interstitial fluid, which dilutes the blood and alters test results. It should always be wiped away. What action reduces the chance of vein collapse during venipuncture? A. Using a 16-gauge needle. B. Using a smaller vacuum or syringe. C. Repositioning the tourniquet. D. Elevating the patient's arm. Answer, B. Fragile veins collapse under high vacuum pressure. Using a syringe or butterfly system with smaller vacuum helps maintain vein integrity. Which test result is most affected by hemolysis? A. Bun. B. Sodium. C. Potassium. D. Creatinine. Answer, C. Hemolysis releases intracellular potassium into plasma, leading to falsely elevated potassium readings. Which test must be collected in a tube with a 9:1 blood-to-additive ratio? A. ESR. B. Point/INR. C. CBC. D. Blood culture. Answer, B. Coagulation studies require a precise 9:1 blood-to-sodium citrate ratio to ensure accurate clotting times. A phlebotomist accidentally draws blood above N4. What should they do? A. Label the sample above 4. B. Discard and redraw from a different site. C. Notify the nurse only. D. Freeze the sample immediately. Answer, B. Drawing above N4 can dilute the specimen. The sample is considered contaminated and must be redrawn from a clean site. Which test requires chilling during transport? A. Bilirubin. B. Ammonia. C. Glucose. D. Cholesterol. Answer, B. Ammonia must be placed on ice immediately to prevent degradation. Delays or warmth will alter results. If a patient is on anticoagulant therapy, what post-draw precaution should be taken? A. Apply light pressure for 15 seconds. B. Skip tourniquet application. C. Apply pressure for longer than usual. D. Bandage immediately. Answer, C. These patients bleed longer due to impaired clotting. Maintain pressure for at least 5 minutes to reduce hematoma risk. Which of the following is true about drawing from a mastectomy side? A. It is preferred if the other arm is bruised. B. Requires patient permission only. C. Not allowed under any circumstance. D. Must be avoided unless physician approves. Answer, D. Drawing on the side of a mastectomy may lead to infection or lymphedema. It must be approved by a physician and documented. Which additive is found in a light green top tube? A. Lithium heparin. B. Sodium citrate. C. EDTA. D. Potassium oxalate. Answer, A. Light green tubes contain lithium heparin and are used for plasma chemistry testing. Which sample should be collected without a tourniquet if possible? A. Glucose. B. Calcium. C. Lactate. D. Bun. Answer, C. Lactate levels rise rapidly during stasis. Tourniquet use should be minimized or eliminated to ensure accuracy. Which of the following is true about order of draw? A. Additive tubes before non-additive tubes. B. EDTA before coagulation tubes. C. Blood cultures first, then coagulation. D. SST before blood cultures. Answer, C. Blood cultures must be drawn first to avoid contamination, followed by light blue for coagulation. Which tube is best for a stat potassium test? A. SST. B. Green top. C. Gray top. D. Lavender top. Answer, B. Green top, heparin, allows rapid separation and is ideal for stat chemistry tests like potassium.